If you're a mom or a grandma listening or thinking something just isn't right, but I can't explain it with my child, you're not alone. Many of the chronic issues that we see in adults, autoimmune disease, hormone imbalance, and anxiety, don't start in adulthood. They often begin in earlier years in childhood after infections, immune stress, or even things like chronic inflammation. At the pharmacy, I can tell you we're seeing rising rates of things like anxiety, ADHD, autism, and sudden behavioral changes in kids that too often the conversation stops at just the label. We really miss about talking about the causes. And today I'm sitting down with a guest that I'm super excited about because we're friends. We work together with patients. It's Dr. Paula Krebstat. She's a pediatrician who specializes in complex kids and helps families understand when behavior is actually biology and how addressing root causes early on can change the health of the patient and the family for generations. Dr. Krebstat, thank you so much for joining me.
Well, thanks for having me, Steve. This is exciting, and let's just rock and roll.
Let's do it. I will tell you, Dr. Krebstat's really unique because she is one of the truly, that I'll call integrative functional pediatricians in our area. She's board certified and not only as a pediatrician, but functional medicine expert dedicated to helping families navigate complex pediatric conditions like autism, PANS, PANDAS, and neuroimmune dysfunction. She blends conventional pediatrics with genetics, gut health, and immune support to create personalized, compassionate care for children and their families. And I'm going to start out with the story right out the gate. I had a parent come in about 5 years ago that was bringing in a child that was being put on an antipsychotic because they just changed overnight. And that's exactly what the parent said is like, oh my gosh, like that happened. And then I started talking, and you could talk about this better than me because you see this all the time. But when that sentence happened, I just started asking questions. And immediately I thought, what did this doctor miss? Because they just stuck him on basically an antipsychotic. When you hear someone come in and say this, what immediately goes through your mind is like, we've got to look a little deeper in like what you do on the functional medicine side.
Yeah. Well, when you hear that a child changes almost overnight, we call that acute. That usually goes into a diagnosis, but you have to tease it out, called pediatric acute onset neuropsychiatric syndrome. It's brain inflammation. So when your brain is hot, red, swollen, and painful, a kid can't unzip their brain and go, look, my brain's hot, red, swollen, and painful, but it shows up in their emotional dysregulation. So essentially, anything that could potentially cause a fever, like a bacterial infection, viral infection, or what we call vector-borne illness, like Lyme disease, Bartonella, Babesia, COVID. We saw so many kids go crazy overnight with COVID, with brain inflammation, influenza, and some of the common viruses. And if their immune system doesn't act like other people's immune system, then, that can deal with the infection, you take an antibiotic or you run the course of the virus and they get better, then it shows up with neurological and psychiatric problems. There's a part of the brain called the basal ganglia that's involved in movement, neurotransmitter production, appetite, like, very picky eating. These kids can develop tics and things like that. So that's what I think about when I see an overnight abrupt change into psychosis.
So that immune system gets dysfunctional because of an infection. And like you said, there's a number of different infections you see that are triggers. And then that kind of walks into this whole thing of what's called PANS and PANDAS, because once again, it may rear its head in different ways, but for certain children, it's that effect in the brain. Just briefly explain what PANS and PANDAS is and how it ties into those infections that trigger those.
Okay. So PANS is an acronym for Pediatric Acute Onset Neuropsychiatric Syndrome. It's an umbrella. And then under that umbrella is one little subsection where it's involved with strep. And it's group A beta hemolytic strep. That's the strep that you get strep throat from. But it can also be a reservoir of strep somewhere else. It could be the skin, the gut, the sinuses. So there is a website called aspire.care. It's the premier website, and it has like the list on how to diagnose this. There is no one test for this. It's all about sitting down with someone and getting that history. So what you saw at the pharmacy with this kid like going crazy overnight, you're like, wait a minute, what was going on? And the thing is, is if a child's immune system doesn't work normally, and it's about 25% of the population has a genetic vulnerability where they can't tag the bad guys the right way. And it's like their body explodes with inflammation and it attacks the brain. So think about with strep, we make a big deal about strep throat. If you don't treat strep throat, you can get something called rheumatic heart disease, and it's toxin mediated. So growing up, if we got scarlet fever, that's strep throat with a rash. The bacteria made a toxin. Well, just like you can get an autoimmune attack on the heart, it's an autoimmune attack on the brain. So autoimmunity means you attack your own body. And so there may be no sore throat, there may be no fever, but when you work a child up, that's what that is. So the other overarching principle I had mentioned previously, influenza, COVID, having another type of stealth infection like Lyme disease and Bartonella. Lyme is all over Texas because we have deer ticks. And then Bartonella, you can get that from cats. You can also get that from other vectors, things that transmit it. So you have to dig deep. You have to, listen, ask a lot of questions. And some of the other things that you'll see with like overnight obsessive compulsive tendencies, severe restrictive eating will be irritability, profound separation anxiety, like a mom or a dad can't go out of the room without their kid being in the same room. Bedwetting that is not due to big tonsils or adenoids or adenoid. There's only one adenoid, two tonsils. Tics, where, rage, dilated pupils, behavioral regression. It's all these things that are involved with that. So that aspire.care website has more, but those are some of the things to look at. And it can be subtle, like ADD, ADHD, with some obsessive compulsive behaviors like you can't leave the house until this is done, or, the child goes crazy. So that's kind of a glimpse of what PANS PANDAS is.
That's great. And I was going to ask you, because you're right, that basal ganglia controls so many things. So it can manifest itself in so many different ways. And like, that's like your wheelhouse of trying to look at that, because like, and you kind of mentioned a little bit, but like, how do you determine if this is like immune mediated inflammation versus like a primary psychiatric condition? You know what I mean? That's a real challenge, and especially for kids. So how do you, I know you kind of mentioned it's a challenge, but what does that look like?
Well, that's an excellent question. So many times what I'll do when I'm meeting with parents and or children, I'll pull up that website and I'll go through the list. In fact, earlier this morning, I did that. And, it was like he had rage, dilated pupils. It was like, I didn't have my kid. I lost my kid overnight. But then he had this emotional ability, like horrible mood swings, and the bedwetting, and his handwriting deteriorated. Another thing that parents can look at, like all of a sudden the handwriting is going off the page. So I try to get a good history. You do a good physical exam. You do labs. So I do throat cultures, even if the tonsils don't look enlarged. We also draw some blood work. One is called an anti-streptolysin O and a DNase-B. Those are little antibodies that can be present if you have strep, group A beta hemolytic strep anywhere in your body. A urinalysis, we want to make sure that it's not a kidney thing. And then a good physical exam, looking for signs or symptoms of vector-borne illness like joints that are swollen, abnormal lines along the back. The thing with Bartonella, which can come from cats, is that there will be sometimes lines that are horizontal on the back, and they're deep and they're purple, and they also may be up on the shoulders, which is just kind of an odd, weird thing. And then I draw some other labs looking at, and this is all through LabCorp request. We use LabCorp here in our office, looking at specific labs for a part of our immune system. There's two parts. There's something called the innate immune system that you're born with and the adaptive immune system. So we look at innate system immune markers, but it's all based on how the child presented. And there's also fancy tests. There's something called the autoimmune brain panel. It used to be called the Cunningham panel. That's really excellent. But if I can arrive at a conclusion using someone's insurance via LabCorp and doing a really good physical exam and getting a good history, I can say your child has X and this is what we need to do. And then we target parts of the immune system to drive down inflammation.
Got it. That's like my next question, because we know some of these infections are really difficult to treat. We're not going to pound kids with a ton of antibiotics and things like that. Some of these are viruses, so there's nothing we really can do. So what then are those lifestyle factors that you look to control so that this child don't stay stuck in this condition? Because I feel like, help me out if I'm wrong, I know these typically start earlier in age. If we don't address this now, this can affect them through adolescence into adulthood, right? And this could be a long-term issue.
Yes. I mean, this is catastrophic, but I had a young 14-year-old girl hang herself a couple of years ago, and that just broke my heart. But she had Bartonella, Lyme disease, and something called biotoxin illness. And we tried, but she made a plan and she followed through. So this is serious. When you're talking brain chemistry, you need to address this because, yes, it can move on. So when we talk about lifestyle factors, a big, huge one, and people may hate me for this, but I'm going to explain why. In our brain, we have something called folate receptors, and that's vitamin B9, cerebral folate receptors. When you consume gluten and when you consume cow's milk dairy, either the whey or the casein, they make short chain opioids, and through a process, they can bind to these things called folate receptors in the brain, cerebral folate receptors. And that blocks the ability to make dopamine. And dopamine helps us with memory, short-term memory, focus, concentration, organizational skills, sleep stability, mood stability, hormone regulation, and cleaning out the cells, detoxifying. All that to say, we're not baby cows, sheep, or goats. Now, I'm okay with grass-fed butter and ghee, okay? But you never drive through the country and see an adult bull or an adult billy goat or an adult sheep drinking a mother's milk, okay? So why are we as humans consuming another animal species' milk that has known inflammatory components that bind to those cerebral folate receptors? Also, they make short-chain opioids and they're very addictive. And so trying to get off of those, this is a lifestyle thing, and the whole family has to be on board. And it's not a death sentence. It's like, oh my gosh, I'm removing inflammation. So I'll just, when I went off gluten and dairy, part of my story is I ballooned up to 300 pounds. I had to ruin my gastric bypass and I started gaining the weight back. And then I did my own little precision genetics. We do something here at our clinic called the Wellness Blueprint. It's a cheek swab. And I identified, I did it via another platform, what my issues were. And it's like, oh my gosh, if my parents had known when I was a child that these things affected me, it would have changed the trajectory of my life, But anyway, lifestyle, this is simple, removing preservatives and chemicals and all those things on the labels of, that you can't read what they are, removing dyes. And we had some of that with RFK Jr., getting rid of red dye. Woohoo! Yay. They used to laugh at people. It's called the Feingold food plan. And now it's part of medical school curriculum for ADD, ADHD, and also MSG, monosodium glutamate. So don't hate me, but one of the most popular fast food restaurants, Chick-fil-A and then McDonald's have a lot of MSG in their food. And so getting that out, getting the dyes out, and moving to real foods and taking out gluten and dairy, that can really, really help. So right there, that's some good lifestyle stuff.
That is, we teach a weight loss class at the pharmacy, and we advertise it as a weight loss class because unfortunately, if we advertise it as the reversed PANS or the reverse blood pressure or reverse inflammation class, nobody would come, right? But you just nailed it because we actually are grain free because, like you just said, many of the grains are inflammatory. All the dairy, like you just mentioned, they drive appetite, they drive inflammation. And we are big on like no MSG. So it's eat whole foods. It's so funny. You just totally explained my weight loss class at the pharmacy. So I didn't realize we had that connection, but we are right on track. So that's awesome. You said that. I like that you said that. I know you're really big in this, and we're going to jump into genetics in a minute because I think that's what really sets you apart. But all these foods you just mentioned have one big effect on a major organ of the body that drives a lot of inflammation, and that's the gut. So when it comes to gut health in kids, and I think this is a challenge because we all know kids, like you just mentioned, the fast food places have got them hijacked, and it's like, this is that's all my kid will eat. How important is food in terms of keeping gut health and then overall conditions? Let's just pick something like eczema. How important is that gut health in terms of something like eczema?
Oh my gosh, food is medicine. So if you put poison in, the skin is a reflection of the gut. So that is like your top thing. So parents, it's a matter of withdrawal, and it can be very, very difficult. If you have Amazon Prime, or at least they used to have this, it's called The Magic Pill. It's a documentary about removing gluten and dairy. And you go, my kid is going to starve. They're not going to eat anything. Sometimes it takes 3 to 5 days for that withdrawal. And when you're really, really hungry, oh my gosh, you tend to eat. Now, there are some extreme cases, but please don't be giving your kids these like Ensure or Boost or going through these restaurants. But if you don't remove those inflammatory things from their gut, then they feed bad bacteria, and those bad bacteria produce neurotransmitters and other bad things that cause inflammation all over the body. And that skin is a direct reflection of that.
I'm going to jump into that gut, brain, but also too like the eczema stuff, because that is one condition. I don't know about you, but it's like we would see some of that when I first became a pharmacist, but I think it's almost like a rite of passage with a child nowadays to get to puberty is have eczema. We'll talk about why. I think you and I know why, but tell me about how the gut and the eczema and the skin thing actually interact in terms of that whole bacteria content and inflammation, and what's your approach to treating that?
Okay, well, basically you treat eczema from the inside out. And, we do these lifestyle modifications. We stop feeding the bad guys, and it just depends on all the presentation. But we get the dairy out. I'm okay with ghee and grass-fed butter. But everything else has to go. And then with gluten, okay? That's kind of non-negotiables. Now, even if you may not have a genetic vulnerability to develop celiac disease, I still recommend taking it out because of that gut-brain connection and those opioids that those things make. And that's why you feel so good when you eat your Bluebell. And the food industry knows it too. And think about donuts. They put fat, sugar, and the gluten together. Gluten is like glue. It tends to constipate you. And almost inevitably with kids that have eczema, they're constipated too. It's like, oh my gosh. So one thing is, and I'm coming back to this because this is how we evaluate this. It's precision genetics. I even have on my website, you can purchase, I have a little Shopify account, Eczema Panel 1. And it talks about gluten and dairy and vitamin D and inflammatory markers. And then it's a direct-to-consumer panel, and people can just buy it, and then they get the results. And it tells them how to help their child or themselves and to target appropriately adults and children with dosing. But back to your original question. Sorry, I got segued there.
No, you're good.
Eczema, there's a substance that concentrates itself in the gut and on the skin called glutathione. Glutathione is the body's master antioxidant and anti-inflammatory. And think about where we fight infections and battles. Our skin, all of our skin, our bladder wall, our gut, our lungs, our sinuses, throat, sinus, gut, all that stuff, and the brain. So if a person doesn't make enough glutathione, then their skin is going to reflect that. But also from a gut standpoint, the majority of the time when we do this little cheek swab thing called the wellness blueprint, and I have people review that in my office with our genomics provider, very frequently the fat-soluble vitamins K, E, A, and D are not optimal. And and I know, Steve, that vitamin D is not really a vitamin, but it's a corticosteroid. And when you go to the dermatologist, what do? They give you steroid cream. So the most powerful, things are steroids, and they cross the nucleus just like glutathione to get into cells. And that is vitamin D3 with K2. It's a corticosteroid. You make it, so you want to optimize it. And you put the two together, and you take that, and that tends to help the skin too. So removing these things that feed the bad bacteria, but some very simple things that parents can do is you can... I don't like to even prescribe probiotics indiscriminately because some people don't need them. But if you have eczema, it's like you don't necessarily want to have a histamine releasing probiotic. Like we carry gummies and caps and things and we base it on our genetics. So not indiscriminately. I'm going to stop there and let you lead.
No, you're great, because what you just said is an approach to fix the problem. Because as a pharmacist, what I see is we start out with a low potency steroid. It works for a couple of weeks. They get off, it flares, and it's the medium potency, then it's a high potency. And now all of a sudden you've got steroids that get absorbed through the skin, suppress that HPA axis, which affects adrenal function. And this whole aspect, it's just a roller coaster. And I see the frustrating thing. In actuality, listening to you made me think about something. I'm real big on fixing and healing up the gut. Like you just mentioned, people have to remove those things that make that gut barrier fall apart. And I'm big on like glutamine and those type things to heal the gut. But then you just mentioned something that was kind of like surprising is, hey, one more thing that's key is glutathione. And I like that you brought that up. So that's a good call out there as far as that goes.
Something you said too is that also, we always think in the functional medicine realm, L-glutamine to heal the gut, along with other things like zinc carnosine and, aloe and marshmallow root, slippery elm, all these other little things that kind of come together. But there's also, on our precision genetics, there's this genetic marker called GAD1, glutamic acid decarboxylase. And if you have that, and a lot of these kids tend to be very, very anxious, L-glutamine is actually contraindicated. Now, glutathione is it's broken down in a particular kind of a little receptor in the brain, but that's where this beautiful blueprint to determine exactly what will work. I had people come to me and say, yeah, I did this L-glutamine and I got so anxious. I was like crazy. I'm like, oh, let's look. Oh, that's why. So maybe not for you, but for people that they don't have a problem, it's a great way to go for sure.
I love that. Let's just jump into genetics because I've been wanting to do that. It's kind of funny. I've always been one when it came to medicine, especially. I'm not saying, in the functional medicine world, we're all taught first thing is, genetics is like the light switch. And so our lifestyle and supplements and nutrients and stress and hormones flip the switches. And I understand all that side. But what I'm learning is, you're right, when it comes to supplements and medications, especially, we can't just throw things on board. And we're going to jump into some conditions because I know some specific compounds we do for you because it's to overcome genetic challenges. So let's jump into one of the ones right now that's used. So right now, vaccines. So the FDA just come out and said, hey, we're going to give a little more autonomy to parents to make decisions about vaccines. This is in your wheelhouse. And this is something, I got a grandkid coming up in April, and I can promise you we're going to do your program because I'm very conscientious about this because I think there's a place for vaccines, but they've got to be done right, the right patient, right timing and all that. Tell me how you take genetics a root cause approach, but then also looking at legit medicine and science and making a determination about vaccines for kids? I want to hear this. I've been waiting to ask you this question.
Yes. So basically, I am not anti-vaccine. Okay. I've been to Africa. I've seen kids die from vaccine preventable illnesses. But I don't even carry vaccines in my office. And we have designed for people that want to a low and slow vaccine approach. And I am just so grateful for what has happened. Because when I graduated from medical school in 1990, the rates of autism were about 1 in 10,000. And right now in the state of California, I think the most recent assessment was 1 in 19 in boys. I mean, it's just hellacious. And what has changed? Our genes haven't changed, but the amount of toxins in our environment have. So what we want to do is create an environment where we're not going to cause more problems. So when we talk about genetics, our body is a smooth oiled symphony, okay? They never change. Now, there are systems, certain things that have what we call rate limiting steps, like you get what you get and you don't throw a fit and your body can't make any more, can't make any less. So and then that influences your immune system and how you absorb things. So bottom line is this: knowing that our bodies were designed to work in this beautiful way, we start first with something called inflammatory markers. And where children and adults run into trouble is when they cannot turn off inflammation. So we identify that. And then we use certain things to modulate the immune system. And just real quickly, there's a system of things called toll-like receptors. There's a system of the endocannabinoid system, and then CB2, cannabinoid 2 receptors. And those are the ones we target in addition to the correct amount of liquid D3 plus K2 and fish oil. And if someone comes to us and they're in a really bad place, we'll throw the kitchen sink at them. But then when they get better, we can pull some things away and just keep maybe one thing to keep the inflammation down. Then there's a system called autophagy. And we've all heard about that because, intermittent fasting, that kind of thing. And that's an ability it means self-eating, and it's the ability to pull sugar, glucose from the food we eat into our cells. And then the cells can clean themselves out, recycle good used part, but then kick debris out into the bloodstream. Then we move into detoxification, which is pee it out, poop it out, sweat it out, and breathe it out. So first, we get all those systems working, and then we address via the genetics how your body absorbs vitamin B9, which is folate, but the right form, methylfolate, and then vitamin B12, and then your mitochondria and essential vitamins and minerals. And it's a staged approach. So typically, we get those genetics. You have 2 consultations with our genetics provider, and that can be done virtually. There's like a little orientation, and we've also created a little course that people can do. And then when they say, I can't remember what this is for, what's the system again? You can go back in and look at that. But then when you've optimized all those systems, you can pick, and this is what I recommend, and it's also dovetails after Dr. Paul Thomas's vaccine-friendly plan. He wrote a book, and I think he had a second one. He received death threats. It's terrible. And now look at what has happened in our country. It's like all the information was redacted, or that has been made known where they covered all this stuff up. And so we've been doing harm and knowing so. So bottom line, when you give the body what it needs in a staged approach, and when you start to vaccinate, these are kind of the guidelines. You don't vaccinate anyone who's been sick within the 6 weeks prior to that time. And you only use 1 aluminum containing vaccine at a time. And if you have certain genetic markers on your blueprint, we call it, because it's a blueprint to cite your child or grandchild or yourself up for success or to recover you if you've had vaccine injury, which we have tons, especially from COVID, to only give one aluminum containing vaccine at a time. We used to have mercury in the vaccines, then we went to aluminum, and it's a known neurotoxin. But then there's all kinds of other things. You can do oral, topical, IV glutathione to detoxify from the vaccine. You can apply glutathione cream over the site or around it. You can do Epsom salt baths. And then I have a homeopathic formula we use here in the office to give around a vaccine to help the body detoxify. And so there's all kinds of ways to optimize the soil of the body before you put an aggressive inflammatory trigger into it. And I'll give you a case in point. I had a little boy that I had followed. I just did his well child check. He's in 3rd grade now. I've seen him since he was like 4 months old. We did his genetics. When he was 4 years old, he got a cut on his arm at a marina, and talk about filthy and dirty. So she's reaching out and saying, should I vaccinate him? And I said, oh yeah, baby. So we kind of walked her through all these steps, and he did fine because he was already on the support for his genetics. So that's how we approach genetics, and it's entirely unique for each child. So
I love something you just said, because you just tied something. A vaccine triggers an immune response. We started out this podcast talking about when you get an infection, it triggers an immune response, and we see all kinds of crazy reactions. So to say a vaccine doesn't have the potential in the right child in the wrong place to trigger an immune response, it's the same reactions. We're talking about the same immune cells. And so to ignore that is a little kind of jaded in a sense. But I think, like you said, I'm not anti-vaccine either. I think done the right way, like you said, following the science, looking at genetics is important. So I got a pharmacist friend that's like, he's all into genetics. And I know right now I hear different things like MTHFR, HLA. Is there any, I don't want to get in the weeds with genetics, but is there multiple genetic systems we kind of look at? You mentioned some of the things. It's not just metabolism, it's immune response, it's things like that. How complex is that in terms of looking at genetics to determine how fast we should put vaccines on board?
If you're layering things in, it's about 5 months. Okay. We support what I said initially about inflammation, autophagy, and detoxification. You're doing that about 2 months. Then you layer in methylation and mitochondria, and we throw essential vitamins and minerals in there too, because some people don't have the ability to absorb it. So you have to give them excessive amounts of something in order to saturate the body with what they need. So the perfect layout would be about 5 months, because you need to be methylating for about 5 months. Everybody's talking about that MTHFR thing, but there's 7 enzymes in that pathway, and there's what we call a rate limiting step to go from A to B. But that whole methylation thing influences epigenetics, turning things off, turning things on for immune and autophagy and detoxification. So it's complex, but we try to keep it simple. It's like, I don't know about you, but you start throwing all this sciencey crap around, and it's like, what's that mean? What's it matter? This is overwhelming. I don't want to know all that. And then there's people that do. So we try to meet people where they are, but that's kind of, Steve, about a 5 month. Once you do the precision genetics and layer it in. Now, in order to create a vaccine plan, we do have, once the genetics have rolled in, then it's a half-hour vaccine consult. We like to do an exam on people, but we're kind of fixing to change some things about how we have people come in. We want to be relevant. We were one of the first functional practices around, and now there's a whole bunch. And we want people to not have barriers to care and barriers to entry. Now, there's all kinds of genetic companies. Some of them are uber expensive, and then some of them are much more reasonable. And that's what I really like about Fagron. They've worked with us and helped us create something that's relatively affordable. If you think about $1,500 to invest, to be proactive, to prevent bad side effects that could have profound manifestations, it's like you're investing in the future. We talk about that all the time. I know you do too. It's like this is an investment in our health and our well-being. So I just love that because genetics changed my life. Yeah, it's like I was clinically depressed for many, many years, and had all these things wrong with me. And nobody could tell me. I went to an internist in the local area and I told him I was suicidal, and then he doubted me. And it's like, it was a statin too. I was taking a statin. He's like, oh my gosh, this statin made you suicidal. And I'm like, yes. And he doubted me. And I'm like, this is true medical gaslighting. I never went back. And that's when you turn,
No, I hear you. No, that's for sure. Let's talk a little bit about nuance with genetics and supplements in terms of some of the things you just mentioned. I'm a big, the fat soluble vitamins A, D, E, and K, omega-3s, like those are so critical and things like that. Let's jump into a couple B vitamins though, because I want to talk about this. Let's talk about B12 specifically, because that's very nuanced. As a compounder, I realize there's kind of 3 big forms. Actually, there's 4 big forms that you can actually use depending on genetics and methylation and pathways, because pretty much when I first learned this, it's cyanocobalamin, which is the old school, which just really shouldn't be used. And then there's methylcobalamin, but there's also some in-betweens like adeno. And tell me your kind of thoughts on that, because I think that kind of gets missed sometimes with people.
Yeah, so adenosylcobalamin is a form of B12 that's not as shelf stable and it's more mitochondrial involved. Hydroxycobalamin and methylcobalamin. Hydroxycobalamin is water soluble. Methylcobalamin is fat soluble. Now, when you take a methylated vitamin, it diffuses across into a cell, but then it can rapidly be converted to hydroxycobalamin. Methylcobalamin costs a little more. Hydroxycobalamin costs less. And so I like to use hydroxycobalamin for my families most of the time because it's just a little bit lower price point. We use it topically, we use it orally, and we do injection. For people that have other competing reasons for why they're burning through their B12, B12 is so necessary for neurologic and brain function and gut function. So that's my little scoop and what I love about hydroxycobalamin.
Awesome. Hot topic right now at the pharmacy. We're having doctors calling all the time talking about leucovorin. You talked about folate, folic acid, folinic acid, and you talked about like mental health, especially neurotransmitter production. Tell me your little short story on that, because that's a hot topic right now.
Yeah, so it was a little frustrating. Several months ago, we heard this from, the current administration about how leucovorin changes everything, and that's not necessarily the case for everyone. So leucovorin is a form of B9 that eventually converts to 5-methyl tetrahydrofolate, and it's involved in 2 different types of pathways. It can cross the blood-brain barrier and bind to those cerebral folate receptors, and it's also involved in DNA synthesis and RNA synthesis. And for some people, some children, it helps with speech. It lowers their stimming, which stimming is involved in autism. But for other people, they don't do well with it, and there's a certain range. Now, something we check here at the office is folate receptor autoantibodies. Now, there's blocking proteins and binding proteins, but you cannot be ingesting cow, sheep, or goat milk dairy because it will bind to those receptors. So if you have a child who's autistic and you have not removed dairy, don't even bother asking for the leucovorin. Just don't. Take out the dairy. But leucovorin is folinic acid, and right now it's not too much commercially available. But the problem is the commercially available has garbage in it too. It's not clean. It's not pure. So as a compounding pharmacist, getting pure leucovorin from PCCA, Compounding Pharmacies of America, I mean, that's what we need. And it can be put into a liquid. It can be a capsule, that kind of a thing. But it can help with those things. But also we take a look at someone's genetics and they may not do too well on the leucovorin, but do much better on 5-methyl tetrahydrofolate. Now, here's a problem. 5-methyl tetrahydrofolate, which is the form of vitamin B9 that we like to give to people when we do their genetics and they have a methylation deficiency. If we have not addressed their inflammation, they don't do well on it. Some people go, oh, I tried that and I developed anxiety. Well, that's my clue. You're still very, very inflamed. We got to dial the inflammation down, get everything else working, and then we'll try layering it in. Those people might do okay on leucovorin and they might start improving, but we may not be able to use the 5-methyl tetrahydrofolate. So that's
a great pearl right there. I like that. That is really, really awesome. Talking about inflammation, only because I know you did it. You were one of the first practitioner in general that I ever seen using low-dose naltrexone in kids topically to help. Like you said, we've got to set the stage for success later. Tell me how like you mentioned toll-like receptors earlier as an inflammation. Tell me how you see LDN fit into this picture in terms of the pediatric side.
Yeah. So a couple of myths to bust. Naltrexone is not Narcan, which reverses opioid overdoses. Naltrexone can be used at very high amounts for people who have addictive tendencies. But at low dosages, it's really, really good for modifying the immune system and lowering the release of inflammatory elements from these things called toll-like receptors. Now, when we identify, so a lot of parents come to us that have a child who's autistic and was vaccine injured, or they have an autoimmune condition or something like that, and they have a brand new baby and they want to prevent that. Or they as a parent have autoimmunity. So when you look up low-dose naltrexone, a lot of times people take it at night, but it can cause vivid dreams. And a lot of the kids I see are having trouble with their sleep, so I don't use it at night. You can apply it topically, you can take it via capsule, and you can also put it in a liquid. But what does it do? So there's these things called toll-like receptors all over our body. And if they, according to these precision genetics, if your body cannot dial down inflammation, these toll-like receptors, they're chronically releasing inflammatory elements. So the LDN binds into the receptor, stays there about around 5 hours, then it lets loose. And then the body makes endorphins and metenkephalins. And when do you need those? You need those during the day when you're facing the stressors of life. So we like to use it in the morning. And so for little babies, I think the youngest we've prescribed it is probably 2.5, 3 months old. And you can use a multi-click, which you know about, and apply it over the pulse points on the tops of the feet, cover the socks, or you can put it on the back of the neck. You can put it over the carotid arteries. You can also put it over the wrists. And then we just keep going up. But if I encounter a child who's not neurotypical and not doing well and is having lots of problems, I'll put them on as much as 4.5 milligrams. And that's pretty much my wheelhouse. Adults and children who have autism, autoimmunity, that kind of a thing. Like all of our kids with type 1 diabetes or autoimmune thyroid disease, we are aiming for 4.5 milligrams. So.
Okay. I got a million other questions to ask you, but I'm going to kind of give you one final one. You know, you're the way I see this, and like I'll use ADHD as an example. If you don't treat them when they're young, this turns into blains later on in life, which ultimately affect hormones and all types of stuff. But you're treating kids, honestly, I feel like right now, and getting with them early, controlling inflammation, you're actually affecting family trees, generational medicine.
Yes.
So because what you do now affects that child that then later makes their own children and things carry on. But if you were looking at grandmothers and moms, what's the biggest thing like a grandmother or a mother can do right now, even if their kids are in teens, to reduce the risk of their grandkids or kids developing these complex conditions later? What's just like one or two big things like you've got to do now to start this process?
Okay, don't be that grandma that's like, oh, just let them have that. Go ahead and pull out the gluten, pull out the dairy, and keep your conversation with, oh, wow, this really helps us be the best that we can be. It's our mindset and what comes out of our mouth. It's not about deprivation. And you got to work on your own stuff, your own baggage that brought you to that place too. And then the other thing that's really important is go to environmentalworkinggroup.org and get rid of all the not highly rated skincare products and home care products that are basically assaulting the body. So you know what I'm talking about. You walk by somebody at a restaurant and it's a man who has doused himself with that stinky Axe body spray. We have a request that we tell people, do not wear perfume, do not wear cologne when you come into our office, because we have so many patients with multiple chemical sensitivities. We have air purifiers everywhere because I treat people with biotoxin illness. So look at environmentalworkinggroup.org. Start with real whole food and clean up what you clean with. You don't have to use that junky stuff.
I love that. So you've talked about so many things today, and this is what makes you unique. You offer unique approaches, especially, as a parent. You'll do anything for your kid. And that's the cool thing that I think you do. You're generational medicine in what you do with pediatrics. So just if people want to learn more about you, how do they learn more about what you do at your practice?
Yeah. So our website is gettotheroot.com. It's the number 2. And on our website, there's quite a few things. And when I mentioned the genetic tests, we have some of those there, but they can also just place a free welcome call. It's a discovery call to find out. We love to discuss genetics with people because it's so transformative. And that's what changed my life. That's what I founded the practice on. And we have seen some beautiful things. We've seen children lose the label of autism, and you don't find that very often. I mean, and even the mom doubting herself, well, blah, blah, blah. I said, no. You went to the Meyer Developmental Center at Texas Children's Hospital. Now, what you said, generational, Steve, autism is almost identical to neurodegeneration and Alzheimer's and dementia. And we treat that gamut here in our office, and you can stop and reverse that. Even if you're older and you're starting to move down that pathway, it's called the cognoscopy, where you look at how to reverse these things. But it's all about our dialogue. It's all about doing what we can do and what we put in our mouth, removing the refined sugar, the dyes, the MSG, and the gluten in the dairy, and that. But yes, the genetics, it can turn the course and the trajectory. And I was 50 when I started into functional medicine. You can teach an old dog new tricks. You really, really can. And so I'm sure you've seen that too as a pharmacist. You started out traditional pharmacy and then found out about compounding and morphed on. So I just really appreciate all your questions, but place a free welcome call, log on, and we have a Shopify account if you want to do that little direct-to-consumer eczema panel. It's a great way to get started. We want to follow it up, but we need to have enough buy-in for panel 1 before we build out the others. But that's a great place to get started.
This is so awesome. I think today, whether you're a mom or somebody that has a child with issues, if you're not looking at infections, inflammation, genetics, diet, and understanding how that affects the brain and overall development, I really think you see it's not about a child with a diagnosis and give them a drug. And if you don't understand how this can affect not only that child's health, but also the health of the family as a whole, because you're right, if you have a child with one of these conditions, it is game changing to that family, and it just doesn't affect the health of the child. It's the whole family. And if you know anybody that watches this podcast today after you listen to it that has that child, make sure you share this with them. I think it's so important to do it. Give us a like. And like I said, I want to thank you, Paula, for coming on today and sharing the knowledge. It's always so great to hear what you have to say, and just really grateful about you doing what you've done to help kids. And it's so awesome. So thank you.
Well, thank you, Steve. It's a privilege to be here, and I'm really grateful for your time too. So thanks a lot.